Actually, there's really just one group. They happen to be very powerful, and that's the trial lawyers. They opposed our medical malpractice reforms, and they opposed these interstate healthcare worker compacts that most states have joined. There's about 10 of them. New Mexico's only in one. We're one of only 5 states that's in one or fewer. And the sticking point is that all of these compacts have a section that says we're governed by a board of governors and they're immune from liability for acts in their official capacities. And you would never sue these people. So if there's a medical malpractice in Hobbs, you're not going to sue the commissioner from Rhode Island.
Mm.
But to the trial lawyers, I'm trying to be fair here. And full disclosure, I'm a fourth generation lawyer. I'm actually a recovering lawyer. I haven't practiced in 26 years, but I have a high regard, and I've worked closely with many lawyers over the years. I have nothing against lawyers, but in my view, they're wrong about the compacts. This is the single most important thing our elected officials can do to alleviate all of these shortages in the near term, and that is to join these compacts and make it easier uh, to recruit healthcare providers. But the trial lawyers don't like the fact that it prohibits them from suing a very small and narrow class of people, like I said earlier, that you would never sue. So they're the only ones opposed. In fact, on the Doctors Compact, which 43 states have now joined, and DC and Guam, uh, they opposed that, even though we had groups like Planned Parenthood and the Catholic Church, who have never worked together on any legislation, agreeing we should join the Doctors Compact because they both have a shared concern that their healthcare clinics aren't able to attract enough staff to stay open. And the only people that stood up against it were the trial lawyers. And
Well,
same thing with medical malpractice.